the Medicare changes for 2023, there's a lot of them, and most of them are decreasing in the cost for either deductibles or the premiums. I have my theories about this. One of the theories is we are getting close to the point where all of the baby boomers are on Medicare. And what that means is we have about 5 more years, and then every single baby boomer will be of age to be on Medicare. This is the biggest voting block in the entire country, as we know, besides the millennials. And as we know, as we age, more people vote, although that is changing now. But to capture this vote, finally, these politicians, no matter what side you're on, have finally realized that the baby boomers need some adjustments in not only their drugs, but also their medical coverage and how much it costs. So here's going to be a lot of the changes that are going into effect in 2023. The first thing is that enrollment in Medicare Advantage plans are up significantly. Now, I've done other videos about this, and I went out to lunch with somebody who is a worked for a national company, I'll just put it that way, for many years. And he told me that what they're trying to do is put everyone on a Medicare Advantage plan. Of course, because this way they don't have to actually control Medicare itself. They want the program to go into private insurance companies. So they're giving these insurance companies more and more subsidies each year to help out people on these plans. Is that necessarily a good thing? I don't think so, but we'll see that in the future. But it's about 50-50 almost, people on Medicare Advantage plans and people on supplement plans. Now, there is a huge difference when it comes to medical for those two, and I have videos on that. If you want to go down and click to get to my other videos, or you can wait till the end and some of my other videos will pop up. But there's a huge discrepancy in how much coverage people actually need when it comes to the Medicare Advantage plans and the Medicare supplement plans. Anyhow, that's the first thing. The second thing is the Part B deductible is decreasing. So in 2022, it was $233 for the year, which doesn't seem like much because the Part A has actually increased, and I'll go into that later in this video. But the Part B has decreased from $233 to $226. Now, if you're getting on a supplement plan, like a plan F, if you can get that, that's going to take care of that deductible anyway. And if you're not, if you're getting on a G or an N, you're going to pay that $226. So it's a little bit less from last year. Now, one of the things that's important is the Part D, which stands for drugs, deductible limit increased. So in 2022, it was $480. Now it's $505. So if you're working with an agent and you ask him how much is the deductible, most likely for a lot of these plans, it's going to be $505 for the deductible for Part D for drugs. But do not fear, because if you're taking generics and so forth, that doesn't mean that they're going to hit you right away with $505. Let's just say you're taking 2 Tier 1 generic drugs, and that's all you take for the entire year. You will not even reach that deductible. Most likely you'll be paying $2 to $4 each time you go to get those drugs at the pharmacy. That's just an average, but you won't even reach $505, just to make that clear. Now, the Part A deductible is increasing. So the Part A will now be $1,600 for the stay in a hospital. That's the deductible, and that's an increase of $44 from 2022. The reason why this is so important, the Part A deductible, I actually speak with people all the time who say to me, I might not get a Medigap plan or a Medicare supplement plan as soon as I turn 65. I might wait because don't I have a 3-month window? Well, you do have a 3-month window, but most likely the cheapest plan in your area could be $30, $40, and there's certain plans that might be, let's just say, $100 per month, possibly even less, that will take care of that Part A deductible 100%. So I always tell people, yeah, you might be saving $50 each month that you wait to get on one of these plans, but that doesn't mean that you're going to get the coverage that you want. So be aware of that. That's $1,600 deductible for Part A in 2023. Now, one of the biggest jumps, of course, is in insulin. And I'm sure you've heard this before. Diabetes is on the rise. I think that has to do with, of course, the fact that obesity is on the rise. So it's not something that we love reporting on, but that's what's going on. Diabetes is on the rise. And beginning in 2023, they started where you get a 30-day supply of insulin capped at $35. Now, that doesn't mean that every plan covers the insulin that you want or you need. The different types of insulin, you have to check out the plans, but they are capped at $35. Now, here's the thing that I actually have to read. It's insulin through a pump, and this is pretty significant for people who take this. Beginning on July 1st of 2023, Medicare enrollees who take insulin through a pump as part of the Part B durable medical equipment benefit will not have to pay a deductible, and they will also benefit from the $35 copay cap. So that, for insulin takers, that is very, very significant. Another thing that's significant is free vaccines. So if you're a vaccine person, you get the flu vaccine, pneumonia, COVID initial shots or boosters, and hepatitis B are free under Part B, and that coverage will continue into the rest of 2023. Now, one of the things that people always ask me is about the shingles shot, and no, it is still not covered by Part D 100%. Some cover some doses, but you might have to pay for your shingles shot, so that would probably go towards your $505 deductible. If you were to get that shot, it might be $200 or something like that, just to make you aware. Now, beginning of 2023, there was put into effect that companies that market both Part D prescription drugs, those bought at pharmacies, because that's where the Part D are purchased at, pharmacies, and Part B drugs, those are the ones that could be something like chemotherapy that are taken in doctors' offices and administered, in outpatient centers. They could face penalties if they increase the prices of these drugs by more than the rate of inflation. So we know that inflation has risen like crazy, but it's starting to drop a little bit, then it goes back up. So look at the inflation rate, and if your drugs are passing more than that, you know that they're going to come down. Okay, another thing that's big is they're continuing to expand telehealth. Now, telehealth became very popular, of course, during COVID. But as we know, just like someone like myself, if we're not having people come into the office, if we can actually do telehealth and you can speak to a doctor, you can get on rather quickly and get some advice and get a prescription and that type of thing, as opposed to going into a doctor's office. That will continue to expand, and Medicare wants the availability to be for everyone that's on Medicare. So we'll watch that. Started in the pandemic, and now it's still increasing. Behavioral health. Now, this is important for everybody because, as we know, mental health is becoming the talk of the town, just like diabetes. Young kids are having mental health problems. Elderly people are having mental health problems. And Medicare wants to expand the coverage that people get for this mental health, or what they call behavioral health. It's kind of a nicer term. But Medicare will be paying for licensed clinical social workers, psychologists, and other behavioral health specialists to be a part of the beneficiary's primary care office visits. So that's something new. They're starting to combine mental health and behavioral health with actual health of your body, not just body, but now it's mind that they're concentrating on. And enrollment access has improved and will continue to improve in 2023. What that means is they used to, if you were late to your initial enrollment, or if you missed an enrollment period, or if you were on a Medicare Advantage and you wanted to get on a gap plan, they had such small windows for you to get into certain plans, or initially get onto Medicare. That is now changing to where they're opening it up and expanding the enrollment period. So you'll have to look out for the general enrollment period and AEP every year, and of course what we're in the beginning of the year, which is called multiple different things, but it's basically another open enrollment for people that want to switch out of Medicare Advantage plans back into original Medicare. I hope this video helped. If you have any comments, please leave them down below. If you need any help with your Medicare supplement plan or dissecting your Medicare Advantage plan or your Part D plan, please call my office. Thanks so much for watching the video, and I'll see you at the next one.